Hello, my name is Andrea Pamilla. I am the State Health Insurance Program Coordinator for the Harford County Office on Aging. The State Health Insurance Program, also known as the SHIP program, is available in each county in the state of Maryland. Our task is to provide information and assistance for beneficiaries on Medicare. Today, we are going to talk about Medicare supplemental plans versus Medicare Advantage plans. This is a topic that we get a lot of questions about. And so we're going to talk about each plan and what's different and what might be the same about them to hopefully allow you to have more information to be able to choose between the two. A little bit of information about Original Medicare. Original Medicare consists of three parts. Medicare Part A, which is your hospital insurance. This is the type of insurance that you would use if you were to have an inpatient hospitalization. Medicare Part B, which is your doctor's insurance. This is the portion of Medicare that is most often used. This portion of Medicare is what covers you when you have regular office visits with your doctor, as well as outpatient visits at a hospital. Sometimes Medicare Part B can also cover medications, such as durable medical equipment. Lastly, there's also Medicare Part D. Medicare Part D is your prescription coverage. This coverage is offered through private plans that contract with Medicare to provide this coverage. These are the three main parts of Medicare, and these are what most people have. However, because Medicare is an 80-20 system, only having Part A and B and Part D would not actually cover all of your health care needs and would leave you with out-of-pocket expenses. Many times, beneficiaries will choose to take a Medicare supplemental plan or a Medicare Advantage plan to help cover more costs that Medicare does not. Medicare was never set up to be a system that paid 100% of your health care, and so for that reason, Medicare has given many options for their beneficiaries to purchase additional coverage to help with what costs that they may have throughout the year. How does the 20% get paid if you don't have a supplemental or an advantage plan? Well, it would be an out-of-pocket cost to you. So let me give you an example. If you were to go to the doctor and have a visit, the doctor's office would bill Medicare. They would pay 80% of that cost, and then the doctor's office would send you a bill for the 20%. A medical bill would never come from Medicare. It would always come from the facility or the doctor's office that you actually received the care from. Sometimes that's confusing to beneficiaries, but please know that Medicare is not going to send you a medical bill. Your doctor's office, the hospital, a lab facility, that's who the bill would come from if you were responsible for the 20%. The 20% can also be paid by a Medicare supplemental plan, or sometimes known as a Medigap plan. Or it could be paid through retiree insurance. Sometimes through an old employer, they offer you medical coverage as part of a retiree benefit, and that many times will pick up the 20% that Medicare does not cover. How does Medicare work with other insurance? If you have Medicare and another form of health insurance, each type of coverage is called a payer. There's a first payer, a second payer. In some cases, there could be a third payer. The first payer is typically always Medicare. So when a bill comes through to Medicare, and that bill is often called a claim, they will pick up the 80%. And the rest of the bill or the claim will go to the secondary payer. That payer may be a supplemental plan or a retiree insurance. And in some cases, if a third payer is available, they may also pay a portion of the bill. What does it mean to pay primary or secondary? The insurance company that pays first is the primary payer. The insurance company that pays second would be your secondary payer. The secondary payer may not pay all of the uncovered costs. So it could be that even with a second option, you may still have a little bit of cost that you still have to pay. If an employee coverage is a secondary payer, you may need to enroll in Medicare Part B before they will cover any expenses. So it's important when you're deciding on your healthcare needs that you know exactly the rules and what you need to be enrolled in in order to get the best coverage. You can typically find that information out by calling 1-800-MEDICARE or talking directly to a Medicare supplemental plan or directly to your employer retiree benefits. First, we're going to start by talking about Medicare supplemental plans, and these plans can also be called Medigap plans. It's important to know that these terms can be interchangeable because sometimes, depending on the literature you're reading, you may read one or the other term, but know that they're talking about the same type of coverage. Medicare and supplemental plans work hand in hand with original Medicare. Again, these plans are offered by private companies that contract with Medicare to offer you this coverage. It's important to know that because they are subject to rules and regulations put forth by Medicare and the federal government on how they can and do offer you these supplemental health insurances. So you are protected with them, that they cannot make changes throughout the year without notifying you or say that they're going to cover something and then not do it in the end. These Medicare supplemental plans can help cover things such as co-payments, co-insurance, and deductibles. Co-payments are something that you would pay at the doctor's office. So many of you may be familiar with a copay, as it's sometimes referred to. When you go to the doctor's office as part of a regular insurance plan, it may be that you have to pay $10, $20, $50 to the doctor's office up front before you have your health care. This is called a co-payment. Co-insurance is a shared insurance between you and your insurance company. In other words, Medicare is an 80-20 system. They pay 80, you pay 20. That's called co-insurance. That percentage can be different for different insurance companies, but for Medicare, it is 80-20. Lastly, a deductible. A deductible is an amount of money that an insurance company determines that you have to pay up front before they start to cover your health care needs. Original Medicare has several deductibles associated with it. Part A Medicare has a deductible of $1,364, and this deductible is per hospital admission. It is not per year. So if you were to have several hospital admissions throughout a year, you may pay that $1,300 several times. Part B Medicare has a yearly deductible of $185. You would pay $185 upfront at the beginning of the year before Medicare Part B starts to cover your health care. These deductibles for Medicare change every year, and they may only change by a few dollars, but they are updated on a yearly basis. So for 2020, you may find that they have increased a bit. Many times, Medicare supplemental plans will cover your deductibles for you as part of their coverage. So again, it's important to look at those different plans and what they offer you. Medicare supplemental plans are offered by private companies that contract with Medicare. And these policies sometimes cover up to 80% things that Medicare does not. An example, a very easy example, is several supplemental plans will cover for emergency care when you're in a foreign country. So Medicare itself is a national program, and what that means is that if you live in Maryland but you travel to Florida for half the year, Medicare will still cover your health care needs while you're in Florida because it's a federal program and it's available throughout the United States. However, if you go on a cruise and you happen to be in the Bahamas and you fall and break your leg, Medicare is not going to cover that because you're not in the United States. However, as part of some of your coverage options with certain supplemental plans, they will provide you with coverage in emergency situations outside of the country. That's usually the only instance where a supplemental company will cover for something that Medicare doesn't cover. Primarily, if Medicare covers it, your supplemental will cover it, and that's usually how that works. Consequently, if Medicare doesn't cover it, traditionally your supplement also will not cover it. 8 things to know about a Medicare supplemental policy as you're researching them. You must have Medicare Part A and Part B before you can sign up for a supplemental program. That doesn't mean that you can't do research on those supplemental plans prior to getting Medicare Part A and B, but you cannot actually enroll until you have Medicare Part A and B. This is particularly important if you're new to Medicare and you're waiting until your effective date. You can certainly, again, call these companies and get the information on quotes and rates, but they can't actually sign you up as a subscriber until you are enrolled in Medicare. A Medicare supplemental plan is not a Medicare Advantage plan, and we'll talk more about Medicare Advantage plans and the differences and likelinesses of these things as we go forward, but a Medicare supplemental plan is not an Advantage plan, and it doesn't work the same. You pay the Medicare supplemental plan a monthly premium directly to have the coverage. It does not go through Medicare. This can be billed directly to you, or it can be taken automatically from a Social Security check or a banking account, but you do pay them directly. A Medicare supplemental policy covers one person. So much like your prescription Part D plans, where they cover just one person, a supplemental policy works the same way. So when you're signing up for supplemental policies, it is definitely possible that a husband and wife could end up with two different policies with two different companies, depending on their healthcare needs. However, keep in mind that many companies will offer discounts if you have more than one policy with them. So oftentimes you do find that a husband and wife will choose the same company because they're offered a slight discount for doing so. You can choose to purchase a Medicare supplemental policy from any company in your state that is licensed to sell one, and that is very important. You always want to make sure that you are purchasing insurance from a licensed provider. This information can be found by calling 1-800-MEDICARE, or you can visit the Maryland Insurance Administration website to find this information as well. A Medicare supplemental policy is guaranteed renewable regardless of health problems as long as you pay the premiums. So if you pick up a supplemental policy when you're 65 and you're relatively healthy, but by the age of 70 you have heart disease, your policy will continue to be renewed for you so long as you pay the monthly premiums. They cannot drop you because of health conditions. A Medicare supplemental policy does not cover prescription drugs. A supplemental policy is primarily there to help supplement Medicare A and B. Unless you are going back to original Medicare, it is illegal for someone to sell you a Medicare supplemental policy if you have a Medicare Advantage plan. You cannot have both an Advantage plan and a supplemental policy. You have to choose one or the other. So keep that in mind as you're shopping around, that if you choose an Advantage plan and it comes with some additional costs, you cannot purchase a supplemental plan to help cover those costs. You have to pick one or the other. Things that Medicare supplemental policies do not cover. They do not cover vision. They do not cover dental. Original Medicare does not cover vision and dental, and therefore the supplemental plans will not cover those as well. It does not cover hearing aids, eyeglasses, private duty nursing, or long-term care. Again, a supplemental plan works hand in hand with Medicare Part A and B. And so if Medicare Part A and B don't cover it, your supplemental will not, with the exception of the case of the emergency foreign travel. Medicare supplemental plans are not going to cover things that Medicare doesn't. Types of insurance plans that are not Medicare supplemental policies. And I point this out just because sometimes there is confusion about exactly what a supplemental policy is. Again, a Medicare Advantage plan is not a supplemental policy. A Medicare prescription drug plan is not a supplemental policy. Medicaid is not a supplemental policy. Medicaid is a federal and/or state program for low-income beneficiaries that helps cover some of the costs of their Medicare, but it is not a supplemental policy. Employer retiree plans are also not supplemental policies. Employer retiree plans are called secondary insurance, and it does work slightly different than a supplemental plan. Many times you may still have a copay, or there might be a deductible, or it includes prescription drug coverage. So it's not a supplemental plan, but it is a secondary insurance that can help defray some of the cost. Veterans benefits TRICARE, which is also a type of veterans benefit, are also not supplemental plans. Those work a little bit more like an employee retiree plan. Long-term care insurance policies are also not supplemental plans. These types of policies are only specific to long-term care, so they will only kick in for you if you happen to go into a nursing home. They're not going to cover for you if you are not in a nursing home. And Indian Health Services, tribal and urban Indian health plans are also not supplemental plans. So there's a lot of different insurance options out there that you can have access to or be qualified for, but many of them are not a true Medicare supplemental policy. When is the best time to buy a Medicare supplemental policy? The best time to purchase a Medicare supplemental policy is during your initial enrollment period with Medicare. When you age into Medicare, which means you're turning 65, you have what's called an initial enrollment period. This is a 7-month window around your birthday when you can pick up all of the things that you need for health care associated with Medicare. During this time, you can pick up Medicare Part A and B, you can pick up a Part D prescription plan, and you can also purchase a Medicare supplemental policy. Why is this the best time? During your 7-month initial window, you are what's called a guaranteed issue. And a guaranteed issue gives you a lot of benefits and price deductions. Guaranteed issue rights are rights that beneficiary have in just certain situations. Again, if you are in your initial enrollment period, or maybe if you have a special enrollment period because you've had a life change, such as a death of a spouse or you move. During this time, an insurance company must sell a beneficiary a supplemental plan. It must cover all pre-existing health conditions, and you cannot charge you more for the Medicare plan based on past or present health conditions. This is extremely important for beneficiaries who may have significant health issues. When you enroll in a Medicare supplemental plan during your initial enrollment period or during a special enrollment period and you have guaranteed issue rights, that plan cannot base your rates on your pre-existing health condition. It can also not raise your rates based on those conditions or put any caveats into place for your healthcare policy. When I advise people on supplemental plans, I typically always tell them that when they're in their initial enrollment period, they need to do their most savvy shopping for a supplemental plan and get the best rate that they can, because you probably will not get a rate this good as you continue on with Medicare. So it's important to take your time and really compare the different plans that are out there and find your best rate. What are some other instances where a beneficiary may have a guaranteed issue? If you lose your current insurance under no fault of your own. So for instance, if your current supplemental policy were to leave the state and not provide coverage any longer, you would have guaranteed issue rights to be able to purchase a new plan. If you had a Medicare Advantage plan and it left your county, you could also purchase a plan with guaranteed issue rights. If you were misled by a Medicare Advantage plan or given false information and you want to change, again, you would have these guaranteed issue rights. Sometimes there are certain situations where a beneficiary may never have guaranteed issue rights outside of that initial enrollment period. So again, it's important to do your very best shopping when you initially go on to Medicare. Can you buy a Medicare supplemental plan outside of a guaranteed issue? Absolutely. There is no open enrollment period for a Medicare supplemental plan. You can shop for them anytime during the year, but you may not get your best rate. Let's say, for instance, that you turn 65 and you pick up a Medicare supplemental plan through company health insurance AB, and you get a decent rate, but a year later the rate has increased to something that you don't think is as good and you want to know if there's something better out there. You may find as you start to shop around, because you aren't in a guaranteed issue anymore, that you're finding that the rates are much more expensive with the companies that you're calling, and that actually the company you're with still has the best rate. So again, you want to make sure when you're shopping for these plans that you're getting the cheapest and most affordable rate that you can at the time. Insurance rates always increase, but if you start low, you have a much bigger window to go to as the rates increase. There are many Medicare supplemental plans available, but there are certain plans that are more popular than others. Most commonly, beneficiaries subscribe to Plan F, Plan G, or Plan N. Again, there's other options available, but these three plans in particular tend to cover the most and leave beneficiaries with the least amount of out-of-pocket expense. And really, at the end of the day, that's what you're looking for. What plan is going to offer me the most options and the most coverage so that I'm not getting bills on the back end after I've received my health care? So I will talk a little bit about those three plans because, again, they are the most popular ones. A Plan F is your most comprehensive supplemental plan. It is also the most expensive supplemental plan, but it's going to cover all of the things that Medicare is not covering and leave you with the least amount of out-of-pocket expense. A Plan F is going to cover both your Part A and Part B deductibles. It will cover the 20% that Medicare does not cover. It also covers what's called Part B excess. This is something that doesn't get talked about a lot, but sometimes happens and beneficiaries aren't sure why. There are doctors that will accept Medicare, but they don't accept what Medicare pays, and they can then charge the beneficiary up to 20% higher than what Medicare paid. This is called a Part B excess. Now, it may not amount to much. You may go to the doctor, Medicare pays, and the doctor sends you a bill for $25. But the Plan F will cover that Part B excess, so you still won't get a bill from your doctor. It also covers for some additional long-term care options in a nursing home, and it gives you that emergency foreign travel policy. This is the most comprehensive plan. This is probably the most popular Medicare supplemental plan. One little word. Medicare Plan F is actually being phased out. However, you can still sign up for it up through December 31st of 2019. But as of January 1st, 2020, they will not be taking any new subscribers. So what's the next best plan if Plan F is no longer available? The next best plan, in my opinion, would be a Plan G. And again, it pretty much covers exactly the same as what I mentioned for Plan F. The only difference is it does not cover the Part B deductible. But the Part B Medicare deductible is only $185. And so sometimes your Plan G can be significantly less in cost than a Plan F, and even with that additional $185, you're still saving money. The last option that I many times give people is a Plan N. Plan N is very similar to Plan G and F. Plan N also doesn't cover the Part B deductible, but it does cover all the other things that F and G cover. The only difference is Plan N requires its subscribers to pay a small copay when they go to the doctor. And because of this, you may find that your quote for a Plan N is significantly lower than a Plan G or a Plan F. And so if you're used to paying a copay and it doesn't bother you, or it's how your insurance has always worked, it might be a good idea to get a quote for a Plan N and see the difference between the three plans. Those are usually the ones that I suggest that people ask about when they call the insurance companies. But know that you could ask for a quote on any plan that is available. I suggest to people that before you call an insurance company, that you sit down and look at your budget and figure out exactly how much you can afford to spend each month on a Medicare supplemental policy premium. Once you've come up with that number, it's really going to narrow down your options for the companies and the plans that you can choose from. There is a lot of information out there about Medicare supplemental plans, and it can be very overwhelming to look at. But once you've kind of figured out exactly what your healthcare needs are and what your budget allows, it will narrow it down to a point where your options are not as extensive. Some other things to keep in mind as you're looking at these plans. Again, I mentioned this, but the regular Plan F is going to be phased out as of the end of 2019. There is a high deductible Plan F that will still be available. It will offer all of the same things that the regular Plan F offers. However, For anyone who subscribes to this type of plan, they do have to meet a $2,700 deductible before the Plan F will begin to cover their healthcare needs. Sometimes this is okay with people who have very few healthcare needs and don't access a lot of healthcare. But keep in mind, if you're given a quote for this plan, that you are responsible for paying for all of your health expenses up to $2,700 before the plan kicks in. Plans such as Plan K and L, after you meet your out-of-pocket yearly limit and your yearly Part B deductible, the Medigap plan will cover 100% of the covered services for the rest of the calendar year. So, as I mentioned, there are a lot of supplemental plans out there, but they all work slightly different. And some do require you to have a significant amount of upfront costs before they're going to cover your healthcare needs. So these are all things to keep in mind as you're making your selection. Plan In, as I mentioned, will cover 100% of your Part B coinsurance, except for a copayment that it asks you to pay at the doctor's office. And this copayment is typically around $20. So when you're calling the companies, just ask for the particulars about these different plans and what your yearly out-of-pocket costs could be estimated to be if you chose it. That way you're not surprised when a bill arrives or when you're asked to pay at the doctor's office. You know exactly what your plan covers before you get into it. How do you compare and choose Medicare supplemental plans? This is really important. And when I talk to people about supplemental plans, this is almost the very first thing that I say to them. Medicare supplemental plans are standardized. And what that means is they're federally regulated and they have to all cover exactly the same thing. So here's an example. A Plan F with United Healthcare is exactly the same Plan F as Mutual of Omaha. They cover exactly the same things. One is not better than the other. One is not covering more than the other. The difference between the two is going to be the monthly premium. And you may find that one company that offers a Plan F may quote you a price that could be up to $100 more a month than another company, but it's exactly the same plan. Many times beneficiaries will automatically go with a, I'll call it brand name supplemental plan because their sister, brother, cousin has it and they told him it was great. Many times these brand name supplemental plans will be much more expensive than some of the smaller companies, but they're offering you exactly the same coverage. So when you're comparing supplemental plans, I always encourage people to call a few of the smaller companies and get a quote. You may find that there is a significant financial difference between the two companies. And if you automatically go for a nationally known company, you could inadvertently be spending hundreds of dollars more than what you really need to spend. So here's a couple of questions to ask yourself as you're looking at these supplemental plans. Are you 65 or older? Age will dictate the plans that you are eligible for. Many times there are folks who are on Medicare, but they're under the age of 65. And if that is the case, they are only eligible for plans A and C through the supplemental policies. What is your budget? I mentioned this before. How much can you reasonably afford to spend on a Medicare supplemental policy? These policies can range anywhere from zero, I've never seen one for zero, but pretty low cost, up to $350 a month. So before you even sit down and look, figure out exactly how much you can reasonably afford to spend, and that will really help you narrow down your options. How is your health? How often do you go to the doctor? Are you somebody who has several chronic illnesses and therefore you see multiple doctors a month? Or are you someone who's pretty healthy and maybe only goes for a yearly physical? All of that can also dictate what kind of plan you may inadvertently decide to buy. If you're in relatively good health and you don't seek a lot of medical care, you may want to choose one plan over the other. But you also need to think about the future because, again, you're going to get your best rate when you initially turn 65. So if you get a plan that doesn't cover much, thinking you're going to save money when you initially turn 65 and go on Medicare, it may be very difficult to get a plan that covers more in the future without paying a lot of money each month. So you really want to pick something that has some good coverage even if you're not using it. Supplemental plans are priced in several different ways, and the term that they use for pricing for supplemental plans is rated. In the state of Maryland, 99% of our plans are what's called age rated. And what that means is that the plan increases in price as you age. So the cheapest price you'll get is at the age of 65, and every 5 years there will be a price jump in your policy. That's not to say that you may not see small rate increases as each year goes by, but a more significant jump will come at those 5-year increments. The other thing that means is that if you choose to pick up a supplemental policy at the age of 75, you're automatically going to be paying more than somebody who picked up that exact same policy at 65, primarily based on your age. So again, this is another good reason to do your main shopping when you initially turn 65. There are a couple of other ways that they can also rate. One of them is called community rated. This is a type of policy that's rated on the community, and everyone is charged the exact same rate based on when they enroll and not based on their age. There's also an issue age rated, which is that they rate the policy on the age you were when you subscribe to it, and it stays at that rate or with slight adjustments as the years go on, as you continue on with the policy. But again, in the state of Maryland, ours are what's called attained age. And so as you age, your policy increases. A great resource for information on supplemental policies is the Maryland Insurance Administration. This website gives you a booklet that they update and put out each year on all the Medicare supplemental plans that are available in the state of Maryland. All of these plans are licensed and they've been vetted by the Maryland Insurance Administration. This is a wonderful resource, and you can download the book and have it in front of you. I have included both the phone number and the website for the Maryland Insurance Administration, and you're welcome to call and actually speak to a person there if you have specific questions about the plans. But at the end of the day, the best information you're going to get about the plans is from the companies themselves. So if you know of a company that you're interested in using, you really want to call them directly and ask those questions because they understand and know the ins and outs of their plans better than anyone. The next few slides I'm going to talk about is the Medicare Advantage plans. These are also an option for people who would rather have an all-in-one type of plan as opposed to taking all the different pieces and dealing with more than one insurance company. These Medicare Advantage plans are also called Part C, and they are an HMO or a PPO type plan. They're offered by private companies, again, that contract with Medicare. Medicare pays these companies to cover your Medicare benefits. When you enroll in a Medicare Advantage plan, they actually become your primary insurance and Medicare becomes your secondary insurance. So when you go to the doctor and the doctor bills, the first payer in this situation would be the Medicare Advantage plan, and the second payer would be Medicare itself. Medicare Advantage plans are regulated to cover all of the things that Medicare covers, but they can offer it in different ways, and we'll talk a little bit more about that. The main thing that you need to keep in mind with Medicare Advantage plans is that because they are an HMO, you have to use doctors and facilities within their network in order for the health care to be covered. So it does limit you on the doctors and the health settings, hospitals, labs that you can use. If you aren't a person that likes to be limited or travel, because in some cases you may have to travel to get to these facilities, a Medicare Advantage plan may not be the best option for you. If you are a person that has an established doctor that you've been seeing for years, if they don't accept this insurance through the Medicare Advantage plan, you would have to change doctors. And for some people, that's not an option. So there's a few things to keep in mind before you would choose to sign up for a Medicare Advantage plan. So how do they work and what do they cover? A Medicare Advantage plan covers all Part A services, all Part B services, and many times they include your prescription coverage. So again, it's an all-in-one policy as opposed to taking your Medicare in different parts. Many times a Medicare Advantage plan also includes some vision and dental services. Very limited, but they do include some as part of their policy. Medicare beneficiaries are still responsible for paying their Part B premium even with a Medicare Advantage plan. So you would still pay the $135 a month on top of whatever your premium is for the Advantage plan. What are some other costs associated with Medicare Advantage plans? There is a yearly out-of-pocket limit for Medicare Advantage plans. Many times it's about $6,700. So what does that mean? It means that you would never pay more than $6,700 a year for health care with that Medicare Advantage plan. And if you met the $6,700, they would actually cover everything 100% beyond that. This is different than regular Medicare because original Medicare does not have a yearly out-of-pocket limit, meaning that during any given year, depending on your health situation, your expenses could go well beyond $6,700 and there would not stop. There would be no limit to that. So this may be one benefit of a Medicare Advantage plan depending on your health. There could be a yearly deductible associated with a Medicare Advantage plan. So while it may cover your regular Medicare deductibles, it may have some deductibles of its own built into the plan that you would have to meet before it covers all of your health care. There may be co-payments for different services. So you may need to pay $10 or $20 at the doctor, $50 to a specialist before they then cover the rest. You have to make sure that your doctor is within the plan's network in order for that to be covered. And again, there is usually a yearly out-of-pocket for your medical services. So these plans just work a little bit different than regular Medicare. They still cover what Medicare plan covers, but they offer it to you in a different type of way. A couple of things to consider about Medicare Advantage plans. They vary by state and by county. So let's say you have a friend that lives in Baltimore County that has 8 options for Medicare Advantage plans, but you live in Harford County and you have 2. This can happen and it can change every year. So don't base your recommendations off of what your friend may have unless they too live in Harford County or in the state of Maryland, because these things can change and they can change yearly. They can come and go year to year, and so keep that in mind when you're making your decision to join an Advantage plan. Again, you have to use doctors and facilities within the plan's network. If you choose to go to a doctor outside of the plan's network, the plan does not have to cover that particular health service, and you would be paying for it 100% out of pocket. If you have increased health needs, you may find that you are paying higher amounts with an Advantage plan than what you would have paid on original Medicare. For someone who sees the doctor infrequently, they may be paying very little by having a Medicare Advantage plan. Many times these Advantage plans are very low cost on the front end, meaning the premium for the plan is very low. However, if you're someone who goes to the doctor very frequently or requires tests or hospitalizations, you may find that by the end of the year, you've spent thousands of dollars more than what you may have spent had you stayed with original Medicare. So these are just all things to think about. If you have specific questions about Medicare Advantage plans, I would encourage you to call the plans that Harford County offers directly and ask them exactly how their plan works and what the costs are. They will be able to answer those questions better than anyone else. A couple of things about fraud when it comes to Medicare, and we usually break this down by remembering the 4 R's. The first is record, review, report, and remember. The first one is record. This is writing down all of your doctor's appointments. If you have a calendar in your house on your refrigerator, we encourage you to write those doctor's appointments down, the name of the doctor, and when you saw them. Note any services or tests that you may have been ordered and when you had those done as well. The second step is to review. Medicare will send out what's called a Medicare summary notice. If you're part of a Medicare Advantage plan, it may be called an explanation of benefits. When these come in the mail, it's important to look through and make sure that the services that they're showing are in fact the ones that you had done. Sometimes there can be billing errors or you're being billed for something that you didn't have done. So it's important to match that up to your calendar and make sure that you're seeing accurate information. You can also set up an account on Medicare.gov, and if you do so, you can see your summary notices right there, and you can look at it on the computer. You can also call 1-800-MEDICARE to ask for this information. If you're, as I mentioned, in a Medicare Advantage plan or with a Medicare prescription drug plan, they too will send out these notices on a regular basis. It may not be monthly, it may be quarterly, but it's important to look and see that they have the accurate information. If you see anything inaccurate, you want to report it by calling 1-800-MEDICARE or calling your Advantage plan or prescription plan directly. The only way to stop fraud is for us to report the fraud. So if you see something that's wrong, maybe you didn't get a bill for it, but you still want to report it because it costs Medicare millions of dollars a year paying for claims that are inaccurate. The fourth step is to remember. Remember to never give out your Medicare number. Medicare did a campaign a year ago where they replaced all Social Security numbers with regular random numbers and letters for your Medicare number. This was an important step in Medicare's attempt to allow you to have safety in your Medicare number and for your personal information to be protected. Never give out your Medicare number over the phone. It's important to remember that Medicare will never call you. If they have a question for you, they will do so in writing. So if you receive a phone call and they're asking for your Medicare number, it's a good idea to know that that is probably someone looking for some type of information to bill you for something that's not correct. So just protect that number. Never let anyone else use your Medicare card and never use anyone else's Medicare card. You don't want to share Medicare numbers or give your number to anyone else. And again, Medicare will not call you unexpectedly. So if you receive a phone call, immediately report that to 1-800-MEDICARE. The only way to beat fraud is to constantly be vigilant in reporting it if it happens. Lastly, you want to protect yourself from unscrupulous sales practices. So there are things that are prohibited, and many times people don't know it, but here's a little list of things that people cannot do. They cannot do door-to-door sales. They cannot give out cash gifts or gifts that exceed $15. There cannot be high-pressure sales tactics. So in other words, if you were to call a company and ask for a quote on something, they cannot pressure you into choosing a different plan that you didn't ask about or signing up for something right then and there. They cannot misrepresent a plan or give you incomplete information. It is really important when you talk to insurance companies that you ask all of the questions and really understand what they're telling you before you sign up for anything. And lastly, they cannot represent themselves as Medicare. So an insurance company cannot say that they're Medicare, and a medical supplier cannot say that they're Medicare. So these are just things to keep in mind. If any of these things happen to you, again, call 1-800-MEDICARE and report them. We hope that the information that we provided today was useful and helps you make decisions if you are choosing between supplemental plans or Medicare Advantage plans. As I mentioned earlier in the presentation, the best place to get the most accurate information about these types of plans is by calling the plans themselves. They are going to have the most accurate and useful information for you and help you make those choices. If you want an unbiased opinion, you can certainly call 1-800-MEDICARE. But again, there are many resources out there to help you make these choices to get the best health insurance that you need for your situation. Thank you.